I focus on training the muscles of the face and the mouth to function properly. What people seek me out for is to correct oral habits, correct their breathing patterns, sleep apnea, mouth breathing, growth optimization in children just by having a proper oral rest posture. There's so many things that it's foundational.
Welcome back to another episode of She's in Sync. I am really pumped for this episode because I have another special guest here today, Stephanie Bavaros. Stephanie is a myofunctional therapist, dental hygienist, and lactation consultant with a passion for improving the health and well-being of her clients. And she's the founder of her business, Ohio Myofunctional Therapy, and the Latchcology company, and she specializes in using myofunctional therapy to help individuals optimize their oral health, improve breathing, and address sleep and posture issues. And she has a special interest in working with women ages 30 through 45 and focuses on addressing TMJ pain and dysfunction, helping her clients find relief and restore balance. And her and I really connected on our holistic view of health. So she blends her expertise in myofunctional therapy with a deep commitment to supporting her clients on their journey to better health. So, Stephanie, welcome. Super excited to have
Thank
you.
you. I'm excited to be here.
So, this episode is all about myofunctional therapy. And this is something that I am still learning about. And so, I listened to a continuing education podcast or presentation about myofunctional therapy, and my mind was completely blown. I feel like this was another area of more of like the functional space that makes so much sense, but I had no clue this even existed. So when I was listening to this presentation, I was like, I need to find some myofunctional therapists in my area because I could think of already a handful of clients who this could really be beneficial for. So all that being said, I'm still kind of new to this. So I'm really excited to have Stephanie on and to like pick your brain. And I think this will be really helpful for listeners too, because this is probably something a lot of you can relate to, but I'm imagining a lot of you are like me who maybe haven't heard of this before. So we'll start with just like a brief intro of if you had to describe like short, sweet, and dirty, like what myofunctional therapy is. Can you start with that?
Sure. So basically, at the very bottom of everything, um, myofunctional therapy is basically just a specialized kind of therapy where I focus on training the muscles of the face and the mouth to function properly. So, of all the muscles that are in the face and the cheeks and the tongue, break all of those down and focus on individual function and strength. And then we put everything back together so that you have that optimal function. What people seek me out for is to correct oral habits, uh, correct their breathing patterns, correct their mouth breathing. I also indirectly kind of work with what happens in the oral phase of the swallow, chewing, speaking is affected. Even though myofunctional therapy doesn't directly treat or correct those things, we're obviously working on the muscles that support those functions.
And then how do you know if you might benefit from that? Because I think there's a lot of people I think are listening and they're like, well, what about like if I have TMJ or if I have like obvious like mouth or oral problems, but a lot of it is not directly related to that, right?
Correct. So yeah, so like I was saying, most people, it's you think of the obvious things like with my pediatric clients, a lot of things are disordered sleep or late age bedwetting, late age thumb sucking or oral habits. But for teens and adults, it gets more into that TMJ dysfunction, that chronic pain. It can be like debilitating for a lot of people. So it's a natural, holistic way to kind of support that. But also, I mean, sleep apnea, mouth breathing, um, growth optimization in children just by having a proper oral rest posture. There's so many things that it's foundational for.
Mhm. And how does all this play into hormones? Because I see a lot of you and I talked before about like my clientele is very much the woman looking to balance their hormones naturally, transition off birth control, really get to the root cause of acne, fatigue, period issues. So how does this play into that, or how does it go hand in hand with like hormone support?
So yeah, I mean, this gets to be a pretty deep rabbit hole. But basically, what's happening if you want to go right into sleep and getting adequate sleep? So the body cycles through sleep every 90 minutes at night. And what we're going through is a REM stage sleep and a non-REM stage sleep. So in the non-REM stage, that is where the body's repairing itself. It's our slow wave sleep function. And that's where hormones are regulated and cortisol and circadian rhythm and all of those things come into play. So when there's sleep disordered breathing or sleep apnea or just a disrupted sleep pattern, we're often you're not going to get into that non-REM sleep. So your body is completely missing that healing stage to repair everything and fix what happened the day before. So sleep disordered breathing, it activates that fight flight system, which increases the cortisol in the body. And the cortisol is that stress hormone. So when the stress hormone is up, when that cortisol is increased, progesterone drops, estrogen rises. So it puts you in that estrogen dominance. So with things like what you're working with, estrogen dominance is heavy periods, mood swings, anxiety, waking, sleep issues, ovulation drops. So people who are getting off birth control, if they're trying to get pregnant, like, well, you have to fix your sleep too. That's such a big part of it. So yeah, so that estrogen dominance is kind of throwing everything off, and it starts with that cortisol being increased from the fight flight, from the sleep disordered breathing.
And I think a big thing too is just being in that chronic state of stress. So, like the word cortisol is like super popular right now. Everyone asks me whenever I'm talking, like getting a presentation. I was at a presentation last night and they asked me about, how do I lower cortisol? And that's such a big topic. And I think it's so, I don't know, I don't want to say like misleading. It is a thing, but a lot of times it's people want to jump to like, what supplement should I take? Or what should I eat? What should I not eat? And it comes back to like the biggest thing, but the hardest thing is managing your stress. And if you're constantly in fight or flight because, of some of these issues or not sleeping, then we can't jump to like a sexy gut killing protocol or,
Right.
do some of those deeper things because your body is stressed from that. And so that's something I talk to clients a lot about. And that is really hard because it's figuring out like what exactly is the root cause of that. And I think especially with the sleep issues, like if you're someone who has sleep issues and you can't really figure out what exactly is going on, like I think that was my biggest like aha moment when I was listening to that presentation and then talking with you. Because doctors will just, prescribe sleep medication and do sleep studies and do the sleep machines and stuff like that. But a lot of times I feel like those don't actually work.
The sleep medication, I mean, that's not allowing the natural process of the body for it to hit those sleep cycles. So it's just kind of like it's knocking you out, but it's not, there's nothing restorative about it. And the sleep machines, I mean, a CPAP and a BiPAP and those things are life-saving. However, there are ways that you can correct that sleep disordered breathing, and there's other options, and you don't have to be attached to the machine. Even with like when people go for a sleep study, when they get these sleep tests, the metrics for measuring how do you qualify for sleep apnea and to get a machine if you needed it, it's so high. But I mean, what's happening below those metrics? I mean, your sleep is still disrupted. Your breathing is still disordered. You still have a lot of dysfunction happening. So there's a lot of low functioning, poor sleep individuals out there who have gone through all this medical testing and they're like, nope, you're fine. And but it's not.
Yeah, and there's only so much I can do within my scope as a dietitian with that type of thing. So we can talk about manage your stress, like boundaries, self-care, like those types of things. But if it's more of like a physical thing in your body that's keeping you in fight or flight, that's when I would refer out to someone like you in combination with our work to really get to, I think the biggest thing is like getting to the root problem. A sleep machine or sleeping pills, like maybe they're going to help you sleep, but it's not actually going
Yeah.
to like get to the root problem of like, why are you not sleeping well? And it's just not as
Yeah.
restful as you were saying.
Yeah. Yeah. And all of this, I mean, it goes hand in hand with the hormone issues and everything. Because even with going back to that estrogen dominance and the progesterone being lower, lower progesterone decreases that GABA, which is our calming neurotransmitter. And that is, I mean, so vital for restful sleep. So it just sets off a vicious cycle.
Mhm. Yeah.
Yes, estrogen dominance, no GABA. I mean, it's just going to keep repeating itself.
Yeah. And I kind of jumped ahead because we did talk about like the hormone balance and stuff like that. So if someone's like considering myofunctional therapy, like I think the
Mhm.
other, I guess you did talk about signs that you need it. And one of the things that stood out to me too was if you're not like a really easy telltale sign if you're not able to make a taco with your tongue. So like curling it like that for people on YouTube who are watching
Yeah,
this.
yeah, yeah.
That's a pretty telltale sign, right?
It is. It's a very basic functional movement that so many people can't really accomplish.
Mhm.
But it's a good way to tell if all of the muscles in the tongue are able to do their job. So yeah, so it's a pretty easy way.
Are there other easy ways that people can kind of narrow down if this is something that might be an issue for them?
So one way is just like everybody right now, just like take a second and check in with yourself. How are you holding your mouth? Are your lips closed? Where is your tongue? Is it low in your mouth? Is it floating somewhere in the middle? Do you have any idea where it is? Because it should be up in your palate. It should be comfortably resting up there. Your teeth should be slightly apart. You don't want to be clenching your teeth together. So that is also a very easy tell. Just what is your oral rest posture at this moment?
Yeah, I love that.
Because
I was
yeah.
I was going through that as you were saying, and I was like, okay, good. Mine is because I was like, oh, mine's up there. Like, I hope that's right. So I'm good. But
Yeah, yeah, yeah. Um, and even, I mean, one of the things I do with my clients is just timing yourself. And I give them like a little, like you can put like a Cheerio on your tongue or something and hold it up to your palate. And what's happening? Is your tongue dropping? Can you hold it up there the whole time? Is it taking a lot of stress? Is it taking a lot of strain? Or is it really easy for you?
Mhm.
Because if it's straining you and it's causing TMJ stress or muscle things going on like in your neck and your upper body, um, you probably need to see me.
Mhm. And I think like going back to the hormone piece too, your thyroid is also affected by this because if like stress
Yeah.
is a big thing for thyroid health. So like underfueling, I talk about underfueling a lot on the podcast and with my clients because that's something I'm really passionate about. Like women are chronically underfueling themselves and we live in diet culture and that's one of the big things that is a tenet of Nourish by Taylor, my business, because I want women to have a better relationship with food and fuel adequately for hormone health. And that is important for metabolism, but also other forms of stress that aren't related to nutrition or maybe physical stressors. So can you talk a little bit about how this impacts the hormones or the thyroid hormones?
So when you're at that chronic stress level, with your cortisol being up, that chronic stress and the inflammation that that causes suppresses thyroid function. So it's going to slow down your metabolism. It's going to make you more tired. It's going to make you have that brain fog. It's like, what's going on? Also, weight gain. So it's all plays into that. The mouth breathing, the sleep disruption increases your inflammation as well. So that there you go, back hand in hand with the the thyroid issues.
Hmm.
So
Yep. And also blood sugar stuff too.
Oh,
And so like
yes.
insulin resistance, blood sugar, diabetes, that's also a piece of this too, like stress and cortisol.
Yes, absolutely. Even a mild sleep disordered breathing. So back to those sleep studies where you don't meet the metrics for sleep apnea, but you have dysfunction in your breathing and you have disrupted sleep, um, that's increases your risk for type 2 diabetes right there, just with that insulin resistance and blood sugar spikes and craving those sweets and everything.
Yeah. And I think, you know, one of the biggest things that frustrates me with, well, I'll just go off the diabetes thing right now. We can talk about every single diagnosis and disease out there, but conventional doctors will, you know, see someone's insulin higher if they run an insulin. I mean, a lot of times they're just going off of like A1C or fasting blood glucose, not like a whole panel, which I think
Yes.
is important to see the whole picture. But they'll oftentimes just automatically recommend reduce your carbs and, you know, start a medication like metformin or whatever. When, you know, that's where in more of a functional space, we're asking the deeper question of like, well, why? What's going on? Or people will automatically be told to lose weight, which, you know, that may not have a direct effect because it's more about habits. Like if someone's stressed to max, they're not fueling themselves properly, telling them to like lose weight and reduce carbs, like that's going to cause more metabolic dysfunction and it's going to add fuel to the fire of a stressed out body versus diving deeper and personalizing it to figure out, okay, is it I'm not sleeping well or do I have a tongue tie, which we'll talk about a tongue tie next because that's another thing. Um, you know, what are the deeper root causes of it? And this is a big piece that we aren't educated about.
It is the the ability for the body to heal and repair during that restorative sleep phase is something I feel like any medication and general medicine is you just can't. There's no match
Yeah.
for what happens during sleep.
Yeah.
So,
Yeah. And this is also, I just want to say too, because like it's normal to have bouts of like sleepless nights or, you know,
yeah,
like totally normal. We're talking like chronic issues with
yeah,
it or like where you feel like you don't know what's going on. So, like, I know for me,
absolutely.
when my nervous system is dysregulated, like I have trouble sleeping and but I know that's like the root cause versus if you're kind of like waking up and you just like can't go back to sleep, you don't know what's going on or it's consistent like you're not feeling stressed but you can't go to
Yeah,
sleep. I think those are signs that like this might be a deeper layer to investigate in. So I just want to
yeah,
say that because I
absolutely.
know for me, it's like when someone's talking about like how important sleep is, like my perfectionist brain comes up and it's just like, oh no, if I get like one bad night of sleep or, you know, a couple weeks of bad sleep, like that's detrimental. But it's like
Yeah,
that's life, you know, like and you have
yeah.
kids too, so you know how that is with like
Oh
seasons.
yeah, 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 absolutely. Um, that is a season that passes, and
Yeah.
there's a reason for it.
Yeah.
But when you're, yeah, like you said, when you are just laying awake or I mean, the fatigue is like constant, and there's really no, like you feel like, hey, I'm like, I slept. I went to bed at 9
Mm,
and I woke up at 6 and I slept the whole time. So I don't understand why.
that's a good one. Yep.
You're not cycling through those sleep cycles. That's likely what's happening. Like you're
Yep.
only getting into those shallow cycles of sleep and you're not getting a chance for that restorative sleep.
hmm That's a great call. I'm glad that you said that because I think that's another easy way. If you're sleeping, but you're not
Mhm.
rested, this
Mhm.
that could be another sign too. And that could be a lot of
Absolutely.
things as well. Like I work with my clients with like mineral replenishment and blood
Oh yeah.
glucose levels, but that could also be from some of this stuff too.
Yeah. Yeah. Yeah.
Um, okay, so tongue tie. Talk about that because I think that's getting more popular. That's actually like
It
one of the
is.
first things that like brought me into myofunctional therapy. What is a tongue tie?
So definitely a buzzword. Um, I would say so. It's it's somewhat for me. It's a little bit of a delicate topic because it has become such a buzzword, and I
Yeah. It's like
feel
me and
like
cortisol. Like whenever someone says, "How do I lower my cortisol?" I'm like,
exactly,
"Oh."
exactly. Um, so yes, there are definitely people who have restrictions, um, which is, and I don't know if tongue tie, we want to explain what it is. It's the piece of tissue underneath your tongue that holds it to your jaw, basically. So it's there. It's supposed to be there. You need it. Otherwise, your tongue would just flop around in your mouth, and it would not be well. But on some people, that restriction comes really, really deep underneath, or it comes really, really far forward. Those people cannot lift their tongues. They don't have good tongue function. Basically, their tongue is, for lack of a better way to explain it, is glued to the bottom of their mouth. Um, and if you kind of take a second and you try and talk without the ability to move your tongue, or try and swallow without the ability to move your tongue, you can kind of get an idea of what they're experiencing. Mm. Going into tongue tie and myofunctional therapy, when I'm looking and doing an evaluation on whether or not I think somebody has an oral restriction or a tongue tie, what I'm looking at is what's happening functionally overall, not just what it visually looks like. So, I mean, in starting with like infants and babies, just for feeding, I mean, to sustain life, I mean, if their tongue is completely stuck to the bottom of their mouth, then they're going to have a hard time feeding. So that can be a whole other conversation. But
which doctors won't address, right? Like they're not going to say anything about that if your baby's struggling with it.
They're going to be like, hey, just give them a bottle and formula, and it's going to be fine. And if that's your choice,
totally fine. Yeah, very personal.
But if you really wanted to breastfeed or whatever, and they're just like, sorry, it's just not going to work out for you. Anyway,
because you can get tongue tie releases for babies. You can do this stuff with babies. Like that was, yeah.
And I feel like that's, from, in my perspective, that's where you mostly think about it. But for adults, tongue tie can be related to not being able to get the tongue up in the palate. So then that leads to all those breathing things, regulation of the nervous system and vagal tone, but also tension, overall body tension, upper body tension. The jaw and the fascia, which is what that tongue tie is, in the mouth, is so deeply connected to the fascia in the pelvic floor. So that dysfunctional connection there is still something I'm learning about, but it blows my mind to see it.
Yeah, I didn't know that.
Yeah.
That's pretty crazy. So pelvic floor stuff is related to this stuff too.
Very much so. If the pelvic floor is unbalanced, and if you look up the spinal chain to the face, often you will see an asymmetry in the jaw, and it's going to balance out what's going on in the pelvis. So that's like structural, bony wise, but that fascial tissue that connects all of the muscles in the body, it goes from your tongue down to your toes, and the majority of it is going to be situated right in the pelvic floor. So tension along any part of that fascia in the body is going to create strains and patterning and pain. Yeah, it's crazy to me.
That's where like the whole body is so connected. Like we can't just treat one part of the body and expect everything to be better. That's where it's cool, but also frustrating and overwhelming because there are so many different components, which is why I'm really passionate about like connecting with other providers who we can work in tandem. Because a lot of times it's not a quick fix. That's why with my VIP one-on-one coaching, I know for you too, with your one-on-one stuff that you do, we require a 5 to 6 month commitment because we want people to not expect a quick fix, but it's setting you up for like a lifetime of success versus just take this pill for your ill or this is normal, just you are supposed to feel like crap or whatever. It's not actually getting to the root cause. And as probably going to take you more, I mean, it is going to take you more time and probably more money and frustration to keep
Absolutely.
figuring it out that way versus getting to the root and working with a professional like you and I to figure that out.
Hmm. Yeah, and I think it's always, I think that's important to bring up is what I do when I work structurally and functionally, but I can't get you to optimal by myself. It definitely takes a team of individuals who are looking functionally at the whole body um, to get you there.
Hmm. Yep, totally. Were there any other things that you feel like we talked about when you and I connected or that you wanted to make sure we
Um,
got to today?
the only other thing that I wanted to touch on is a little, it's kind of what is before going into the the hormone issues with the sleep and talking about that vagal tone.
Oh, yeah.
Um, yeah. So one of the things when you look at proper oral rest posture, and I just want to clarify that when I say proper oral rest posture, what I'm talking about is the tongue resting up in the palate comfortably without strain, the teeth being just slightly apart, um, the lips being at a comfortable lip seal, and you're breathing through your nose. So those four things are what I work to achieve in myofunctional therapy. Aside from having proper breathing and during your sleep to regulate that cortisol and to get into those restful sleep patterns, the vagal nerve, which is I don't even know how to like
The
explain it
longest cranial nerve
easily.
that
The longest nerve,
yeah,
yes.
it goes through
Um,
your gut. Like it's super important
yes,
for digestion, nervous system, everything. I talk a lot
yes.
about that. Yeah.
Yeah, it literally like regulates all of the things. Um, so there are branches in the palate of the vagal nerve. So when the tongue is up in the palate, it's activating and stimulating the vagal nerve constantly. So if you think back to like if you were a child who had a pacifier or sucked their thumb or oral habits or things like that, um, what's happening is I'll just use the thumb as the example is the thumb's in the mouth and it's touching the palate. And the reason that that is calming is because it's stimulating the vagal nerve, right? So what we want is for the tongue to replace that and the tongue to be up in the palate to have that to stimulate and be that regulator. The other thing that's happening is when there's a proper swallow pattern. So the tongue is coming up to the palate in that swallow, and whatever is coming down the throat. I mean, it's that whole branch of the vagal nerve. So it's like giving the vagal nerve a little bit of activation and a workout constantly over and over and over and over, which is so big for regulation of the nervous system.
Yeah.
So just wanted to touch on that a little bit as well.
Yeah. Yeah, it's called vagal toning. So it's like, yeah, it's a workout for your vagus nerve, which is really important. And you can stimulate your vagus nerve too by like humming.
Yes.
Oh my gosh, what's the breathing called? I just did yoga this morning and I'm like the deep breathing where you kind of like breathe out
Yeah.
your ujjayi
The
breathing.
diaphragmatic. Well, yeah. So I work with that. That's part of the therapeutic process with me is like we do humming,
Hmm.
we do deep diaphragmatic breathing, because all of those things are stimulating that vagal nerve. So
Yeah. I am doing a nervous system course right now. I've talked about it on the show before, but Vital Side. And one of the exercises the other day was to hum like Twinkle, Twinkle, Little Star. And it was so
mhm.
funny. My dog was like, what are you doing? I was just sitting there humming it. And he just looked at me like, huh? And he came over and was like licking me. I don't know if it was what was happening, but he thought that
Yeah.
was weird. So, but yeah, just simple things like that. You can hum or singing like in your car, like in the shower, whatever. All those things are like great ways, if anything, just to start, toning your vagus nerve, which can, it sounds so simple and like kind of silly, but it works and it does help regulate your nervous system. And it's a super easy thing you can just start incorporating like today.
It is. And yeah, and it's really is a precursor to setting you up for that restful sleep,
Hmm.
uh, is having that balance
Yep. Yep.
through. with the vagal tone and the nervous system balance, and being able to come from fight flight to rest digest and just be in that constant even flow throughout the day.
Yep.
So that vagal nerve stimulation is, like you said, so easy to do,
Hmm.
and to help you.
Yep. Awesome. So before we talk about how people can find you, just to wrap up, I always ask my guests how they are nourishing themselves physically, spiritually, emotionally, whatever during, this time of their life. So is there a way that you're nourishing yourself at this point in time?
Yeah. So actually, I mean, we're coming into my favorite time of year. I love spring. Here in northern Ohio, I
Yeah.
mean, we're still having a lot of gray days. It was just 35 degrees yesterday, but today it's going to be around 70. So being outside and getting a little bit of sunlight every
Yeah.
day, my favorite thing. And I love like watching everything bloom and the restart of everything at
Mhm.
this time of year. So
Yeah.
that's my thing.
Yeah. We're
Um,
we're both in Ohio, so it's that weird season where it's like, oh, it's spring. Just kidding. It's actually
just
winter
kidding.
still. Oh, it's spring
Yeah,
again. So whenever we
yeah,
have those
like
like sunny days when it's like finally getting warm, I feel like we embrace it. So,
absolutely. Windows open outside for a
yep.
little bit, like
Sunshine
just
on your face. Yeah.
yes.
I love that. So I'm sure this episode opened up a lot of eyes, and we hope it was really, really helpful for you all listening. If someone wants to find you and they are like, I feel like you're speaking my language and I did not even know this, like I'm interested in working with you, or just
Yeah.
like following you or reaching out to learn more, where can they find you? And we'll put this all in the show notes too.
Yes. So I'm not super active on social media. That I try. I try. Maybe that's one of the ways I nourish myself also is kind of staying away from it.
Hmm.
But
Fair.
my website is super full of information, and that is ohiomyofunctionaltherapy.com. There's contact information on there, that you can either reach out. Texting the number on there is probably the best way to get me. But there are contact forms as well, and I respond to all of those too. I do work virtually, so I have clients all over the country, and I do have an office space if you are local to Northeast Ohio. But otherwise, yeah,
Yeah. So anyone listening can work with you.
absolutely.
Yeah, that's awesome. Cool.
Yeah,
Well, we'll put your website in the show notes and we'll put your social just in case, who knows,
just in
but
case,
I don't
once in a
blame you.
while.
Social is yeah, it can definitely wear on you like in
Yeah,
many ways. So whenever sometimes you'll like a post, I'm like, oh, Stephanie liked my post. She's on social media right now.
yeah, yeah. Just
Like a
like
little treat.
once in a while.
Yeah. Awesome. Well, thank you so much for being on the show. Again, I think this is going to be super helpful for people. And for those of you listening, thank you so much for tuning in. Please like this, rate this, share it with a friend who you think could benefit. And until next time, stay nourished.